and we welcome to the program Heather Reid, Chief Nursing Officer at Baptist Hospital of Union County. So, Heather, thanks for coming on. Appreciate it.
Thank you. Good to be here.
Tell us about the Baptist Hospital in Union County.
Sure. The Baptist Hospital in Union County is located right in downtown New Albany, and we are offer a lot of services to the community, just about any service you could think of. We've incorporated a lot of telehealth services over the last couple of years, as have a lot of other hospitals in our area and in Mississippi. But you know, we can take care of our emergency department's known for its care of cardiac patients and stroke patients, and we have orthopedic surgeons, pediatrics. We have a great labor and delivery department at our hospital, and so we do a lot of great things here.
Yeah. I pass it on the way in. You can't help but see it, right? When
That's
you're
right.
headed into town here. So it looks like a really happening place. And from the outside, at least from the grounds, looks like it's really well kept. That usually is a pretty good indicator of the quality of what's going on the inside as well.
Absolutely.
Yeah. So as the Chief Nursing Officer, what's your responsibility there exactly, Heather?
Sure. So I have responsibility for all of our nurses in the building and nursing support staff. So, you know, approximately 150 nurses or so.
Wow.
And surgical techs, nursing assistants, patient care assistants, unit coordinators, and so on and so forth.
Yeah. All right, so tell me about the very high rating the hospital has received from the CMS, Centers for Medicare and Medicaid, at the federal level.
Absolutely. We just received a 5-star rating, not our first time, but we're very proud of that. 5-star rating by CMS, and that's for quality of the care that we provide for our patients.
Yeah, so did they actually come on site and do some just analysis and review, or there's some reports you have to complete and provide some data?
There are lots of reports, local and national reports that hospitals provide regularly, and they look at those reports. They look at our metrics. A lot of that is abstracted directly from our electronic health record.
Okay.
So that comes not necessarily from them being on site, but just from our metrics.
I see. And you told me before we came on the air you've got a health fair coming up. Tell us about that.
We do. We're excited to offer a community health fair on October 5th. We'll be set up. We'll have a big tent in our back parking lot of the hospital, and we will offer lots of free services to the community. Blood sugar screenings, cholesterol screenings. We have a lot of participation by local clinics in the area that will also be present, and we'll be helping with that. So we're going to do some diagnostics, some lab work and things like that during the health fair, and it's all free.
And do you get the results of that lab work
we will.
right away, or how does that work?
Well, some of the results we will receive right away. Some of the results we'll ask for your primary medical physician,
Okay.
and we'll send those results directly to them, or we can refer you if you do not have a primary care provider. We can refer you to one of our local providers for that.
Are folks pretty willing to come and do the screenings like that, or are folks more hesitant, shall we say, just maybe afraid of learning what they don't want to find out about?
I will tell you, we always have a great participation.
That's good.
In all of our community events. We just had, I think, over 500 kids participate in a back-to-school health fair, and we did some, screenings there and gave out a lot of different school supplies and things at that event. We usually have, over 100, 200, 300 people that participate in these events.
So a lot of times you could detect something that is not a serious problem, but something you need to take care of to kind of avoid having serious problems down the road. That's what it's all about.
Yes, and sometimes we detect serious problems.
Okay.
We find out that someone has really serious issues with hypertension.
Yeah.
And sometimes we actually, or blood sugar, their blood sugar is just dangerously high, and so there are times when we actually have to refer people directly to the emergency department.
Yeah.
In those cases.
But that's a lot more convenient, I guess. A lot of people just don't take the time to schedule an appointment with their primary care doctor and go through the wellness checks and the annual physicals that they should be doing. This way you can just, hey, it's all happening today, and show up, and we'll take care of all that in a short period of time.
That's right. And, During the pandemic, a lot of people neglected that preventative care, and we're seeing that. We're seeing that in the number of hospitalizations we have now.
Yeah.
A lot of things are creeping up just because we missed those opportunities for screenings and preventative care.
Read something on that yesterday, a nationwide situation.
Yes.
It's happening across the nation, exactly what you were talking about. Didn't really address that or take care of that during the pandemic, and now they're sort of getting back to it, and that's we're starting to find things we should have known about a couple of years ago, and now it's a little bit more serious, and they got to take care of it.
Absolutely.
Yeah. Well, congratulations on all of the outstanding recognition for the hospital, Union County, Baptist Hospital, Union County. Appreciate you coming on, Heather. Thanks a lot.
Thanks so much.
We're stepping aside for a break right now. It's time for Fox News, SuperTalk News. That's because it's top of the hour.